Okay. Hello, I'm Erica Howard, and I will be testing the cranial nerves of Mr. Watson here. And we'll get started in just a moment. I'm going to begin by showing you my ID. It's not a great picture, but it's me. See it pretty good? All right, so I'll begin by having my patient to introduce himself.
My name is Willie Watson, 11/18 today.
11/18/58 is his birthday, and I am Erica Howard, and I will be testing your cranial nerves. Is that okay?
Okay.
Okay. So the first cranial nerve we will test will be his olfactory nerve, which is a sensory nerve, and it tests his sense of smell. So I am going to go over here and see, open a few already. And I'll start by asking Mr. Watson to please close his eyes and occlude one of his nostrils, which he's already done, and sniff.
Alcohol.
Okay, he says that's alcohol, and again.
Alcohol.
All right, so that is his cranial nerve number 1, and they appear to be intact. He was able to smell the alcohol. So next we will do cranial nerve number 2, which is his optic nerve. And Mr. Watson did advise me that he wears glasses for corrected vision. He doesn't have his glasses today, which is fine, because for the sake of filming, I can have him to step closer to the Snelling chart. Come on, Mr. Watson. Normally we would have a Snelling chart that's a little bit larger, but for the sake of being in someone's home, we wanted to respect their space. So he's already covered one of his eyes, and I will have him to read the line above, the red line. Read the letters above the red line.
A-D-L-G-C-Z-P.
All right, and the next eye?
A-D-L-C-E-P-L.
Okay. And if he misses one or more of these letters, I would just have him to go up to the next line. If he were to get the whole line right, we would just go below that line and continue reading until he can no longer see them. So the next exam that we're going to do with Mr. Watson is check his visual fields. So have him to step back over here, and I will cover one of my eyes and he will cover one of his, and he will let me know when he can see my fingers in his visual field. So you ready, Mr. Watson?
Yes.
All right.
Now.
All right, let's do the next eye. All right. And just remember to always document if your patient wears corrected vision, or if he's, doing with the unaided eye. I just think that's always good to add to your documentation. So the next exam we're going to do for him is the foloscopic exam. And with this exam, we would normally have the room dark, but because of filming purposes, we won't have the room dark. And what we're checking for is his red reflex, his physiological cup, his arteries and veins. We'll also check the focal and macular area. You just want to do a visual exam of the eyes before you even get started. Make sure you don't have any drainage or any redness or puffiness of the eyes. Also be sure that you don't have any mass or anything. I will check his eyes. Are you ready, Mr. Watson?
Yes.
All right. He has his head a little twisted. I'm straightening it up for him. Yeah, just a little bit. And I'll check this eye. And I'll check this eye using my. All right. And like I said, for the sake of filming, I did not turn the light off, but normally you would turn the light off for this test. Now, the next cranial nerves I'll do will be cranial nerve number 3, number 4, and number 6. And they are oculomotor, trochlear, and absum. Those are the ones that I'll be checking this time. And we'll also do a visual test. So with this test, we'll have Mr. Watson to follow this object without moving his head, and we'll check this checks his muscles in his eyes, just to be sure that his eyes don't deviate when they're supposed to be moving together in sync, and make sure he doesn't have any lazy eyes and things like that. Ready?
Mm-hmm.
All right. So he was able to do that without any problem. And we'll also do the cover test. And normally for the cover test, you'll leave this in place for about 30 seconds and then have him to remove it. And what you're trying to see is if one eye deviates or moves in the opposite direction after the 30 seconds. And we'll just let him do it for demonstration. So, Mr. Watson, you hold this in front of one of your eyes. This side. A little bit closer over that way. Good. And like I said, you would do it for about 30 seconds, but for the sake of filming, I won't have him to. And could you do the other eye? All right. Good job. So next we will, thank you, Mr. Watson. All right. There's one final test for these eyes, and it is the cornea light reflex. And when you do this test, you normally have the room dark and or dimmed, and shine the light on the bridge of his nose, and you just want to be sure that the light reflects equally. So it's the cornea light reflex. So yeah, and they do. So the final test for these nerves, which are motor nerves, would be the Perla test, where you check his pupils for, make sure that they're equal, round, and reactive to light and accommodation. Normally the room would be dim, but like I said, for testing purposes, I'm not gonna have it, but I'll just dim his eyes with my hand, just so. Yeah. And we do have a reaction. All right, so I would say that cranial nerves number 3, 4, and 6 are intact. So next we will test trigeminal nerve, his trigeminal nerve, which is cranial nerve number 5, and it's actually a sensory and a motor nerve. So we will start by checking his nerve branches. And I have something that is sharp and dull, and you would test it by, placing the object on his forehead, cheeks, and chin, and letting him tell you if it's sharp or dull. So, ready, Mr. Watson?
Mm-hmm.
All right.
Sharp. Duh. Sharp. Duh.
Oh, sorry.
Sharp.
So that was sharp. Sorry. Sorry, that was sharp.
Duh. Sharp.
Okay. Another test that we would do for this cranial nerve would be the corneal reflex. And I'm not going to do this particular test on Mr. Watson just because he's a good patient and I don't want to make him mad at me. But I would get the cotton ball and place it lightly against his cornea, and his reflex should be to blink, and that would be a normal reflex. So I'm just going to act it out. And he would blink. So I didn't want to really do that test on him, but that's how you do it. So the next thing for this nerve that we would do would be having him move his jaw like this from side to side. He is doing it. He is able to do it, and without any difficulty. And I would also palpate his temporal and his mastoid muscle. I would have him to clench down on his teeth, and I would palpate. And when you palpate, you just want to make sure that it's strong and equal on both sides. And his is 5 and 5. So I would say that cranial nerve number 5, his trigeminal nerve, is intact. So we'll move to cranial nerve number 7, which is his facial nerve, and we will start by checking his taste. So I do have something. And Mr. Watson, if you don't mind, if you would close your eyes, and I'll bring something over there for you to taste. All right, so just stick out your tongue. I'll have him to stick out his tongue. And, okay, he says he can taste sugar, and that's correct. It is sugar. But when he does look at his tongue, just check his tongue for symmetry, just to be sure that it's symmetrical when it comes out. Just look at the color of it. Make sure it's not too thick. Whenever you're doing something, just always kind of, do little assessments during your assessment. So that is his taste. And I also would say that this cranial nerve is intact because he was able to taste this. No, there's one more test for this. It's when the raising of the eyebrows. So let me get him to do that. I'm sorry. Moving a little too fast. Okay. So Mr. Watson, if you don't mind, would you raise your eyebrows? Can you show me your top teeth and your lower teeth? Lower teeth. Can you smile and puff out your cheeks? Puff them out. I know you can puff better than that. Like this. You suck it in. Like this. It looks like he's sucking in. Wait, do this one more time. Good. He's able to do it. He got it. All right. So that's cranial nerve number 7. And I wouldn't normally laugh at a patient. I don't want you to think that. But next we will check his acoustic nerve, which is cranial nerve number 8. Number 8. Cranial nerve number 8. And there are 3 tests that we do for this nerve. And the first one will be the whisper test, then the Weber test, and the Renee test. So I'll start this test by holding my hand in front of my mouth and whispering something to Mr. Watson, and I will have him to occlude his ear, cover his ear. So you ready, Mr. Watson?
Yes. Popcorn.
All right. And do your next ear.
Eyes.
Okay. So with the Weber test, we're checking for hearing loss, and the way that we do that is I would hit this and hit it and place it on his head. If he had conductive hearing loss, the sound would lateralize to the affected ear. If it's suraneural loss, hearing loss, he would actually have if the sound would lateralize to the non-affected ear. So make sure when you hit nothing but fork and not anything. So you want to make sure you're not touching up here in order for it to bounce pretty good. And Mr. Watson, can you hear it?
Mm-hmm.
All right.
Yes.
All right. So the next test we would do will be the Renee test. And with the Renee test, we will also hit the fork, and we will place this on his mastoid process. And this is, we test because air conduction is greater than bone conduction. So we'll see what it says. So normally this test would take about a minute, but for filming purposes, of course, we don't want to take up too much of your time. So we'll ask him when he can feel it, and then when he can hear it. Ready, Mr. Watson?
Mm-hmm. Hear. Feel it.
Yeah, feel it. And what about now?
Hear.
You can hear it.
Mm-hmm.
Well, not when he can hear it, when he can no longer hear it. I'm sorry. We should be asking him when he can no longer hear the sound. And like I said, you would do that for a minute. So I want to correct that. You would see how long he can feel it here and when he can no longer hear it here. And this test usually takes about 1 minute. So I would say that cranial nerve is intact, and that was cranial nerve number 8. So next we will do cranial nerve number 9, which is the glossopharyngeal cranial nerve, and we'll also do a taste test with this nerve. So I'm also going to have Mr. Watson to close his eyes again, and I'm going to bring something over there for him to taste, and I'll have him to stick out his tongue. And you try to apply this to the posterior 1/3 of his tongue, kind of way in the back. Okay, let me make sure I get enough on there that he can taste it. All right, I think I got enough. All right, so stick your tongue there a little bit, Mr. Watson. I'm gonna try to get all the way in there, not too far back. All right, now can you taste it?
Sugar.
And he said it's sugar. So while looking back there, you also want to kind of check his swallowing reflex and everything, but I'm going to also check his swallowing reflex when he says "ah." So I'm gonna get him to open up really, really wide and say, and I'm gonna check for swallowing. I'm gonna look at that uvea back there, just to be sure that when it moves symmetrically, and it moves, you know, in a, not a rapid fashion, but a nice smooth fashion. Because sometimes if you start seeing it where it's not moving, could have lesions or things like that going on. So look your tongue out. Oh, sorry, Mr. Watson. And he did a big so that's good. So another way to check excuse me, this cranial nerve would be the gag reflex, but for the sake of this video, I'm not going to check this reflex. You kind of have to be careful sometimes with checking that reflex, because sometimes people will vomit. You just kind of have to give them a warning that you're going to check that reflex. So I would say that this cranial nerve is intact, cranial nerve number 9, and it's a sensory, well actually that was cranial nerve number 9 and 10. It's the glossopharyngeal nerve, as well as the vagus nerve. So I did both of those together, and I'm sorry, that sensory and motor nerves, I did those together. I'm sorry I didn't announce that. But next I'm gonna do cranial nerve number 11, and it's spinal. And this is I don't want to say it's pretty easy, but it's what we check with this is we're checking the muscle in his shoulders, and I'll have him to lift his shoulders against resistance, and I also have him to move his cheek from side to side against resistance. And you're checking the trapezoid muscle as well as the sterniomastoid muscle. So Mr. Watson, if you would, will you lift your shoulders? Good, you did very good. And I'm gonna also have him to move his cheek. So I'm gonna touch your face, and I want you to press against my hand, okay? All right, and again. Okay, so that's cranial nerve number 11. And for our final cranial nerve for Mr. Watson is the hypoglossal cranial nerve. And with this cranial nerve, all we would have Mr. Watson to do would be to put his tongue in his cheek like this. And we will check that nerve. And it looks like he's already doing it. So, all right. And he is able to do it without difficulty. And this is cranial nerve number 12. And I'd like to thank Mr. Watson for being my patient and letting me practice on him all day and for several days and hours. So thank you, Mr. Watson. And I would like to thank my camera lady for all her help being patient. And thanks. And it's cranial nerves 1 through 12.
Thanks.
Okay. She has to do a final turn.
Oh.
And it will be done.
Thank God. All right. Thank God.
Well, she's not done. She's not done doing the 360. She's almost done. She has to do top bar. Did you press stop?